r/AskReddit. Doctors of Reddit, what made you say how? Are you still alive? Part 2. Not a doctor, but my father is a dentist who found a framing nail in a guy's head in his brain. 6 days after it happened. So the guy's wife worked for my dad and worked construction. He fell one day and landed hard face first into his nail gun. He didn't realize it went off firing a nail through his mouth into his brain. Due to lack of insurance he never went to the hospital. After a week and the swelling still hadn't gone down, his wife brought him into the dental office to get a panoramic x-ray done, usually used to see the whole set of teeth, and lo and behold, photo of x-ray. He just thought it was a lot bruising and swelling from hitting his facepoint news story. Whoa, that's crazy. At least they were able to nail down the source of his pain. This really hammers home how beneficial the work of the Curie family was. He didn't realize it had gone off. That's a sharp one there. Nurse here. 50-year-old male came to the ER after falling and not being able to get up. His testicles were so engorged they came down to his knees with a width 1.5x greater than his thigh. Penis was completely retracted into his scrotum. Had a cord scan that showed his entire large intestine, most of his small intestine, and his pancreas had herniated into his scrotum. You could auscultate his bowel sounds through his balls. The surgeon said she had never seen anything like this, and that it takes months to get that way, and only happens in third world countries with poor/no access to medical care. She couldn't do much, because his diaphragm had become so accustomed to the altered space in his abdomen, that if she put his organs back in his abdominal cavity he wouldn't be able to breathe independently, would need to be ventilated permanently. The poor guy had mental health issues, I believe schizophrenia, which is why he was in the condition he was in. He was still able to pee all by himself. I had a minor hernia when I was 12ish. Had never had surgery before, and was a little nervous. My doctor was a little Asian guy, and very high energy. He told me a story of another patient he'd seen with a hernia that had gone untreated for too long. The doctor's exact words were, in a thick Chinese accent, "Maybe not so bad right now. A little sore. But if you not get fixed, in 1 year, ball be down to knee." Best medical advice/warning ever. Old guy comes in with his wife. She tells me he passed out last week and I couldn't wake him up. After about 2 minutes he came around, and he didn't want to go to the hospital, so we booked an appointment to see you. I'm a little concerned by this, and his heart rate is a little slow, so I sent him for an EKG, heart rhythm tracing. I get a call about an hour later from the cardiologist reviewing the EKG, calmly thanking me for sending him in, because the wiring in his heart essentially wasn't working, and he could drop dead at any moment, again. Because the week before, he hadn't passed out, he'd died. Through some lucky miracle his heart started again. He's got a pacemaker now, and he and his wife are doing just great. Casually dies. It's really awesome when you're waiting to see the heart specialist, and he takes a look at your EKG, and says you need an electrician, not a plumber. I have my own ICD. BPM went from 3 to 186. Guy comes in with a bit of chest pain, tells me the big coronary artery on the front of the heart was 100% blocked. I tell him, who told you that? He says his doctor did about 10 years ago. I don't believe him, since patients never ever get any of the stuff their doctor tells them, right? I'll let the cardiac surgeon know what this guy said, and he too goes haha 100%, so he's dead. If the biggest coronary artery is totally occluded, and for 10 years no less, you are a dead man. Lo and behold, we get an angiogram, and it was fucking 100% occluded. The artery on the back of the heart made a connection with the front of the heart to pick up the slack. It was some lucky shit. So his heart essentially gave itself a bypass? Yay. Bastard is putting us out of work. I had this happen. Started getting chest pains at 35 while mowing the lawn. Was alarmed, but with no family history I assumed it may have been the ant meds I had recently started. Fast forward 4 months, I'm in for a med check. At the end of the checkup, I mentioned the chest pains, and it seems to be less bad than it was. Doctor sent me in for a stress test, failed it. Sent me in for a nuclear stress test, failed it. Cardiologist set me up for a cardiac cath, told me that if they find a blockage they'll put a stent in. Apparently my lad was 100% blocked, and new paths were opening. I was just like, so I have better cardiac blood flow than most people now? And he just gave me a hopeless look. Been running 5 days a week for 8 months now. Pathologist here had a guy who had died suddenly and unexpectedly. I soon learned he was the recipient of a lung transplant about 15 years prior. When I opened the man up, his transplanted lung was upside down. I flipped the lung into the proper position, and bloop. It flipped right back to upside down. That was quite alarming. The surgeons who originally performed the transplant incorrectly attached the organ. When he by chance entered the correct position, the lung flipped over, causing his pulmonary artery to seal shut, resulting in his death. The man lived for 15 years with a lung that was dying to flip upside down. And it was only by sheer chance he didn't move in such a way that allowed it to do so until the fateful day of his death. It is one of the most fascinating cases I have ever witnessed. This one actually made me say wow. That's unbelievable. Did you ever discover what movement or action he did to cause it to flip? No, we did not. However, once we were looking at it, it was clear the lung was fighting to flip the entirety of its stay. Anything could have done it. Bloop. This is not a word that I expected to hear used to describe the action of someone's lung flipping around. Not a doctor or anything, but my grandmother has had 7 strokes. I couldn't help but laugh at the 7th one. She said, "AWW shit, I'm having another stroke." She said this during a phone call abruptly. She's a very tough lady. She runs a garden and eats her in vegetables. Vegetables have kept her from becoming a vegetable. She's inoculating herself. Eats her in vegetables. I think this stroke thing is genetic. My great aunt had bad arthritis and lupus. She was told by her doctor when she was 20 that she wouldn't live 10 years. She saw that doctor die before her. Next doctor said she would die before 40. She saw that doctor die before her too. Third doctor said, "I'm not going to tell you when you're going to die because I'd like to see my old age." She eventually died in at 78. Never duck around with old tough ladies. They're indestructible. Simply meeting someone who was 110 years old. Working as a phlebotomist, I've been slapped by a patient old enough to remember a good chunk of WWI. I wasn't even that mad, it was like getting hit by history. "Hey, what's that on your face?" Smacks you. It was raw history, sonny boy. I used to do elder care, and was constantly amazed at some of the tough badasses I took care of. Never as old as 110. But, man, 99. Once ate dinner with First Lady Eleanor Roosevelt. Made sure to serve me ice cream as his wife of 73 years lay dying. I was caring for her. She was in a coma and on her last journey because it was a warm afternoon and manners must be followed regardless of circumstances. I tried to refuse, but he's 99 with a dying wife. It was Strawberry. Woman, 96, was in the nursing corps in the Navy/Marines in WW2. She married a Marine. She told me, "I always like him rough and ready." Her lecherous grin spread its icy fingers into my soul, and I had to laugh. Woman, 101, tried to murder me with a clothes iron, because dementia can change people into superheroes when they think the care aide is a stranger breaking into their house. Woman, 96, an atheist Jew from New Jersey, with the accent to boot. WW2 Navy nurse. She would threaten spam callers with murder. Graphically, it was hilarious. She also had me pick up a package for her. Turns out, She gets her weed delivered. Caliph. Not a doctor, but been a paramedic 15 years. Had an 8-year-old kid on a ripstick, similar to a skateboard, lose control and roll into the path of an oncoming SUV in his neighborhood. He was hit by then run over by it. We arrived to find him face down under the vehicle, unconscious, barely breathing. After all was said and done, he had bilateral femur fractures, one lower leg fracture, multiple rib fractures, a blown pupil, and open skull fracture, subdural brain bleed, attention pneumo, air escaping lungs into the chest cavity, will squish the lungs and heart if untreated, and when we were bagging him, breathing for him, we felt subcutaneous emphysema, free air that crackles like Rice Krispies / bubble wrap in his hip. Yes, hip. We flew him to the children's hospital expecting him to die within the hour. He was in a coma 4 days and had to have multiple surgeries, but made a complete recovery, 100% neurologically intact as well, and graduates high school in the spring. His was such an amazing case the hospital made him one of their miracle kids of the year. Parents, please make your kids wear helmets. Even in the neighborhood. It wouldn't have prevented all of his injuries, but would have substantially lessened the brain trauma he suffered. It amazes me y'all can run up to a scene like that where a kid is broken to pieces and keep your calm to get the job done. You're all heroes in that respect to me. Thank you. A patient I took care of had a car fall on his face. He was underneath it working when it slid off of the jack. The only reason he survived was because he broke every bone in his face. He had a left third, which allowed for his brain to swell. He also needed an additional surgery to relieve the pressure of cerebral edema, but the facial fractures did allow for a great deal of give in his skull. I was rotating through ICU, so I first saw him just a day after the accident. His head was so swollen, he didn't even look human. Fast forward a few weeks later, I was rotating through a different unit in the hospital and came across the same patient. He was quickly recovering and had minimal neurodeficits. Edit. For patient privacy purposes, I cannot give the age of the patient or location of the accident. I'm also not disclosing how long ago this was for the same reason. And of course I do not have photos. As for minimal neurodeficits, I saw this patient very briefly a few weeks after the accident. At that time, he still had edema and was in the process of getting better every day. I use that wording considering the severity of his injuries. He still had progress to make, but was able to walk and talk, had no memory deficits, not including immediately after the accident and his time in ICU, of course. I did not follow his care all the way through to discharge, so I don't know what he was like then, or in the months following the accident. I wouldn't be surprised if he went on to go to college and is living a normal life. He was a younger patient and younger brains tend to be more plastic, in that they can recover from injuries better than someone who is older. Edit 2. A few people have asked why they don't break facial bones as a last-ditch effort to relieve brain swelling. They do break the skull, just not the facial bones. They can make small holes called burr holes, or if the swelling is really bad, they can temporarily remove entire pieces of skull, a craniotomy. Sometimes pieces of skull are stored in the abdomen to keep them alive, so that they can put them back later. So like, how did his face look after you saw him again? After having a car on it, if you could describe it as a face that's looking pretty good. I was in school to be a paramedic, and I was doing my externship in an ER. A guy came in happily complaining about a sore on his belly that wouldn't heal. He was really pleasant, and didn't seem to be in much pain. When he lifted his shirt, we could see his liver. Holy crap, I would have fainted. Well, that sounds like bacteria and agonizing slow death. Did he die? I don't think so. He definitely went up to surgery, still smiling. Had a gentleman in his late 50s come in with multiple myeloma. Short history of progressively worsening breathlessness. Turned out he had a pulmonary embolism, blood clot in his lungs. He was a good candidate for surgery, so he had the blood clot removed, but unfortunately the clot had caused such bad issues with his heart, acute right heart failure, that he couldn't be weaned off the bypass machine. Instead, he went to IQ on ECMO, like a circuit for your heart and lungs outside the body, to give your heart/lungs time to rest. His chest was still open, cannulated centrally, but covered up with sterile stuff. After 3 days, he was booked to be weaned off the ECMO or at least have the tubes put in peripherally so his chest could be closed. Morning of the procedure, while he's waiting to be moved, somehow the tubing of the ECMO machine broke, oxygenator tube, and blood spilled all over the floor and he went into cardiac arrest. The cardiothoracics consultant had to do internal cardiac massage, basically CPR on the heart, by squeezing it via his still open chest until the circuit got fixed and he returned to a normal circulation. He ended up going to OT and having his chest closed, but he had more clots pulled out of his pulmonary arteries. Clots had recurred. At this point I thought this guy was utterly fucked. I figured if he even lived long enough to be woken up he'd have some degree of ischemic brain injury. After about 2 weeks the guy left ICU and a week later went to rehabilitation. Speaking, walking, cognitively largely intact. It was one of the most unbelievable things I've ever seen during my short career. My dad is a nurse, and he had to do an internal cardiac massage once. The patient didn't make it, not surprising. But when my dad came home from work he was still in awe of having touched someone's heart like that. He couldn't shut up about it. I don't think I would have been able to either. Yeah, my dad had 2 heart valves fail at once, had them replaced, and the surgery went well. Get called back into the ICU that night, and they said he was going into pulmonary failure, and didn't know if he would make it to the morning. They ended up hooking him up to the ECMO for probably 2 weeks. Made a full recovery, and none of the doctors could believe it. When they pull out that machine you know shit's getting bad. I've never seen anyone leave ECMO alive. I'm a nurse. Had a guy walk up to the front desk after hitting himself in the throat with a chainsaw. All the flesh of his neck was flayed open. I could see his trachea and his right jugular vein. If he had cut in just a tiny bit deeper, he would have sliced right into both. The only thing that saved him was that he was a big fat guy with a huge neck. A skinnier man would have died very unpleasantly. The unseen benefits of obesity. Not a doctor, but my best friend's Bill during the Super Bowl this year was acting totally normal until about halfway through and started talking gibberish, walking into walls, taking all his clothes off, and generally being not himself. It took about 5 EMTs to even get him in the ambulance, because he was fighting them all off, and he continued to do so, until they took him to the local hospital, where he was put into a medically induced coma, and airlifted to the shit is real hospital. Turns out he had bacterial meningitis, and he had been acting like that, because his brain had gotten so swollen. Everyone was convinced he was going to die because of how severe it had gotten before he presented any symptoms. It took him weeks to recover, relearn how to talk, understand where he was, etc. But he did. He completely 100% recovered. Doctors think it was caused by a dog bite, which I've never heard of. His wife and kids also tested negative thankfully. Wow, I'm glad it turned out okay for him. I don't think anyone will be able to beat his Super Bowl stories now. Only funny because he's okay. Blood alcohol of 0.730. How is that even possible to live through? Like, he should been dead way previously to that. Too much blood in their alcohol system. Hey doc, UCLA hospital has you beat hands down. A 24-year-old woman came in with a serum alcohol concentration of 1510 mg/dl, which corresponds to a BAC of 1.33. And yep, she survived. FYI to laymen like me, this isn't an urban legend. It was published in Lancet, which is one of the top medical journals in the world. Story time first. Some backstory. In Brazil, you can do internship way earlier than in most of America and Europe med schools, so keep that in mind. I was in my 4th year of med school, and in the first day as an intern in a trauma hospital, after training, there was a bus crash right before, so all the staff was occupied, when a woman came in screaming, "I am going to die. I got shot in the head." When I look up I see a really thin woman, deep eyes, white as snow skin, with a bullet hole in the center of her forehead. She told us she owed money to a drug dealer, and he put a gun against his head, shot and ran. Now, I believe because she has burn marks and gunpowder right there in her skin, and a hole. Now remind that I'm a student, and there was no available doctors in the moment. So I run to my professor, that was with another patient, and tell her story, and also that she is lucid, with normal life signs, and get her order to do a CORT scan. The CORT shows that the bullet entered the forehead trough, the first layer of the frontal bone, but not the second, and headed down trochanter palatus, traught and stopped at a vertebra, C5 if I recall correctly. No brain damage at all. So we intern her, and a tracheostomy is put in place, along with emergency reconstructive surgery, only a first, not definitive approach, along with a cervical collar. After she is stable, 3 hours later in her room, 3rd floor, we go down to see other patients. The emergency then gets a call. "Hello. We are from the X-hospital, 20 kilometers away from ours, and we found a patient of yours in our emergency." Then the nurses on the floor realized she was missing. She jumped a 3rd storage floor, broke her ankle, and got in buses, and went the other hospital. Why? I saw him in here. He came to finish the job. And before you ask, yes, some people lost their jobs. TLDR, shot in the head patient could walk, talk, scream. That is some Hollywood shit right there. You've reached the end of part 1. You're a ducking star. If you like this, check out part 1 and 3, like and subscribe for more like that.